Hello and good afternoon, everybody. It's your happy, healthy Dr. Alicia, who is coming to you live from New York City. I am the health and wellness coach, as you all know, and I focus a lot on reproductive justice. I'm going to have a really exciting conversation today with my dear friend and colleague, Sylvia Espinal, who is a psychotherapist and for individuals, couples, and for families. So we'll just hang tight while we wait for her to join us. We're going to have a great conversation today about othering and how, in the context of the Black Lives Matter movement that's happening, strive for social justice, how that, the process of othering, the idea of ethnocentrism and also racism all play into mental health of women of color. So we will hang tight while she joins us. Give me just a moment, please.
Did I do
Okay.
it right?
Yes, you did it right.
Hi.
How are
Well, I'm glad I
you?
was so good. I was
You
so
were
ready.
worried you
I
were
was
gonna
thinking maybe.
you're gonna screw it
Yes,
up.
I'm not going to get it right.
Yeah, it's pretty simple to log on. But thank you so much for
Yes.
joining me. Happy Sunday on this gloomy
Happy
Sunday in New York City.
Sunday. Thank you,
Yes.
thank you, thank you, my friend.
Yes, so I was just introducing you, kind of telling our viewers all about the wonderful work you do with immigrant families, individuals, and also couples, and that you're a psychotherapist here in the city, and that you work a lot with populations of color, women of color, families of color, to really help them kind of navigate through their experience of being new arrivals to the United States, which of course is like a whole new layer, I feel like, of intersect when you talk about like intersectionality, kind of how these different identities intersect to create our experience in this country, how like being new to the country and also having maybe not your English being your first language, how that all kind of contributes to your experience with racism, othering, and ethnocentrism in the US. So um so
Yes, that's
we
true.
love the work you're doing, especially in light of everything that's happening in our government's official stance on immigrants, which is deplorable.
Mm-hmm, mm-hmm.
So yes, girly. So tell us, like, well, one, how's your Sunday been, and also how do you feel like the pulse of things are going with your clients right now?
Yes, thank you. Sunday is going good. It looks like summer is leaving us, which is not so okay. But yes, just people might know a little bit about me. I am interested in this work not only a professional interest, but it's also a personal interest. You know, as an immigrant myself, as a person whose English is her second language, then that really made me want to explore and really learn from the migrant community. So there is a personal passion there for sure. And yes, you know that when it comes to how the this anti immigrant of color sentiment, how it has affected our communities, it's very palpable. You know, it's definitely something that is in the air that migrants breathe. It has impacted them tremendously.
Mm-hmm.
We always, you know, when I speak with our families, you know, with the families that I see, there's often a constant fear. You know, there is a constant fear of being one foot in, one foot out, and
Mm-hmm.
constantly are being exposed to discrimination and even not being welcomed, and even
Mm-hmm.
for the second generation too, right?
Mm-hmm.
That they are American citizens, English speaking, and there is a clear message that, for example, their parents or one of their parents are not welcome here. You know, so
Mm-hmm.
so yes, that's in my practice and in the work that we do. We're often talking about this fear, this anti-immigrant of color sentiment. So
Mm-hmm.
that is palpable for sure, my friend. Unfortunately, like you say, is deplorable.
Yeah, I mean it's actually now, not that it wasn't kind of already institutionalized in the way that our government kind of carries out policies in terms of who they allow in the country, and the quotas that they set, and also visa restrictions, visa fees, those kinds of things that all could provide barriers for people trying to gain access to the country. But I think there's also this, very incorrect idea that people who come here who are of color are, here to somehow like perpetuate crimes or to, these horrible
Mm,
things, when in fact people are here because they're fleeing their countries for better opportunities or for education, or because their lives are in danger, their families' lives are in danger. I mean, on a very human level, that should resonate with everyone in terms of it
mhm,
being, for many people, an issue about their health, their family's health, their life, their livelihood. And these things are very serious things for people. I mean, I would imagine that, if I had the choice to leave my home, that's a very serious, like, weighty decision to decide to leave your home, for good. To seek refuge
exactly.
in another place where you don't necessarily speak the language as well, that you're not super familiar with the culture. Um, but, like I said, on a very human level, when you're talking about human life and when you're talking about children and humanity, that shouldn't, everybody should be welcomed, right?
Mhm.
Who are seeking refuge from danger.
Right, or at least have and also have a proper system in which people
Yes.
can feel freed and okay to apply,
Hmm.
right? And
Right.
we know that and we're talking about, for example, the experience of refugees, asylum seekers,
Hmm.
that that are either living in their countries, internally displaced, or waiting 1 year, 5 years, even 11, 12 years to come to the United States, and this is not going away.
Right.
For example, climate change is a new
Yes.
situation which is going to make so many people flee their countries. So what
Right.
are we going to do? What is
Right.
what are industrialized, powerful countries? What are they going to do in order to have a proper system to allow families to live, to make it, to survive?
Yeah, absolutely. And when you say a proper system, also a fair system, right? A system that's
Right,
not necessarily rooted in racism, where preference, people from, Europe or, other rich industrialized countries over people who are coming from poor countries.
right,
So yeah, a
right.
more egalitarian system where, all people who are looking to come to this country and make a better life are able to do so and are really seen equally under the law. And I think that that's really a huge, huge issue, right? And everybody knows it, who's had family members who tried, you're trying to bring family over who are people of color, and it's like impossible now, at this point.
They're making
So
it harder and harder for sure. Yeah.
yeah. So, with this being, such a central part of that their experience, what are some of the things you feel like, that you see is why, seeking mental health, particularly in these communities, is so important?
Yeah, I think that so first of all, the migrant community, besides all of these disparities in access to mental health care, again, that there is a clear message of not being welcome and not being wanted. So there is experience of discrimination, that in so I think that those messages that people can receive about being othered, being less than, being not English speaking, being othered, right? That
Mm-hmm.
can create these internalized messages about themselves, about their families, about their communities, about their groups. So then it's inevitable that those internalized messages can affect their emotional health, their physical
Mm-hmm.
health, their spiritual health,
Mm-hmm.
the way that they interact with others, the way that they are present, emotionally, physically for their families, for their jobs, and for their communities. So if communities of color, migrant communities will be able to have more access to mental health,
Mm-hmm.
a place where perhaps there is cultural sensitivity, and then that will give them an outlet, another choice, that they can have. Give people choices, right? Give the migrant community choices. Yes, they say, oh, some in some collectivistic cultures, people, they go to their churches, they go to their families, they go to the wise people in their communities, and they seek, a support. Yes, and they can have mental health, um, professional mental health support. So it doesn't have to be either or. It needs to be all of these parts where people can have this kind of support. And some people, unfortunately, they say there is a stigma, right? That the migrant community don't go and seek mental health because there is a stigma. Yes, there is a stigma in mental health, um, just obtaining, mental health. And so then destigmatize mental health, at a local level, at a state level, at a government level, that then stigma is not the only reason why migrants, the migrant population, don't access mental health care. There are so many other obstacles, right? That are in place, so then they don't have access to mental health services. So yes, that is also provided bias, a lack of cultural sensitivity, um, the stigma, and the unwillingness to undo the stigma. So,
Mm-hmm.
so all of this creates so many barriers for
Mm-hmm.
us to access mental health care.
Absolutely. You mentioned bias, which I feel like, in my practice, because I work primarily in the Bronx with Spanish speaking community, that for those of us who speak Spanish, it's like, we see everybody equally, and language isn't really an issue, right? Because you can kind of communicate fluidly with patients, and also they can communicate with you and be able to really express to you what they're thinking and feeling in their body, right?
Right,
Which is super
right.
important for people to articulate how they're feeling in their language, right?
Yeah,
Their native
yes,
language.
yes, 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 for sure.
Um, but for those who don't speak Spanish and who, who are just like, there's, in terms of just like using a provider, a language line, or, or even just making the effort to have a third party translator who's an official medical translator, not like a family member or somebody like that who
Hmm.
really may not necessarily be able to explain in the level of detail, the counseling that's required or education that's required for patients. Some people just decide that they don't want to bother because it takes a little more time. I mean, there's a lot of systemic barriers, right? Like it does take more time when
Right.
people don't necessarily speak the same language as the patient, and the system doesn't really allow for that, right? It doesn't
Hmm.
allow for
Hmm.
you to spend extra time with people that are needed. That's needed.
Right.
So,
Right. Hmm.
yeah, provider bias is a huge issue, I think, for people who are non-English speaking, because also there's a lot of and who are just culturally different, um, because there's just a lot of assumptions about
Hmm.
what people
Hmm.
do in their cultures, or assumptions about why people may make certain health decisions that they make, or why there's a mistrust, for providers. And I think that assumption is incorrect, right? We should always like try to probe a little bit more about what motivates people to make those
Right.
decisions. But
Yeah. Yeah.
yeah, provider bias is a huge problem. What do you
Hmm.
feel like in your practice you see a lot of clients who, I mean, I know whenever I see people like, oh, this is Spanish, I'm not going to see anybody else. I'm like, okay, no problem. But also, do you feel, and I feel like a sense of connection with that person and they with me because of the language connection. But do you feel like the same thing in your practice as well, that people are just like so overjoyed to have that language and culture connection with you that makes them feel
Yeah.
more
Yeah. Yeah.
comfortable
Yeah.
and makes them feel more at ease to really kind of, that therapeutic alliance that we speak about, that's like so important in
Yeah.
reaching
Yeah.
people,
Yeah.
helping them. Yeah.
Yeah, yes, that's true. But can I say something before we go into this question? That
Yeah.
I did not know you were fully, almost fully bilingual in
Oh,
Spanish.
girl. Yes, girl.
It wasn't until we went to
Oh,
Cuba
right. Yeah, yeah. Okay. Yeah.
that I, that I heard you speak completely. I was thinking, oh, I might have to translate for Alicia, maybe, and then you were, I got this. You were completely, fully bilingual. I
Well,
didn't know that. I know that, when we were at Montefiore, that you were fluent in Spanish, but not, really, really good at it. So yeah,
yeah,
that
I
was a nice
mean,
surprise.
yeah, I mean, I definitely think for me, it's super important, like, to be bilingual. And I always say this, like, when people always ask me, well, what are some of the things that we can do to try to undo racism or undo, cultural bias? I really feel like language is such a powerful conduit to that. I always say that, like, you go to other countries and people speak multiple languages. It's not a thing. It's just like people speak two, three, four languages, and it's
Yes.
just not a thing. But here in the US, it's like, oh, if you speak even one additional language, there's this wow factor about it. And it's just mostly because, speaking another language isn't valued,
Mhm.
and
Mhm.
even though it's offered in school, I feel like the instruction is not, there isn't like a serious investment in ensuring that children can become fully bilingual, through the
Mhm. Mhm.
educational system. Um,
Mhm. Mhm.
so
And
I
it,
always feel like that's one of the most powerful ways, right? Is to
yes. Yeah.
expose
Yeah.
yourself
Yeah.
through language.
Yeah. And even for this, for children who have who speak another language at home, at times that has been shamed. If they
Mm-hmm,
will speak their home language outside their homes,
mm-hmm,
then that will be shamed, or kids will be made fun of. Parents will be concerned, oh, my kid is going to be seen as an ESL student. So,
mm-hmm.
so yes, um, this prejudice against people who speak another language, when it's supposed to be a plus, it's not a minus, right?
Right.
And yes, and yes, in reference to provider bias, that I think that's something that it's what we believe is to be very conscious of what are your own personal values, your belief
Mm-hmm,
systems about
mm-hmm.
others,
Mm-hmm.
others who are different, and
Right.
how that impact the way that you treat them.
Mm-hmm,
That the way that you speak with them, the way that you see them, the way that you think, about them.
mm-hmm.
So, and because then there is this, if as providers we're not aware of how we our belief systems, our values, might, get in the way, or if we don't acknowledge that, there's little room for differences,
Mm-hmm.
then yeah, that impacts the way that we treat others. And I
Yeah.
think that we can use translation services. Why not? That
Mm-hmm.
definitely speaking another language will be great, but yes, seeking to have these translation services, a phone in the office,
Mm-hmm.
even, for example, when I see clients that speak other language than English and Spanish, I ask them to speak, of course, as therapy is different, but
Mm-hmm.
I ask them to speak in their native language. I ask them to share with each other, and whatever they would like to say in their mother tongue. That is
Mm-hmm.
so super important.
Yeah.
And I also think that even though Spanish, is a colonized language, that if we preserve, Spanish is a way to to hold on to our culture.
Mm-hmm.
That is a way that we can hold on to our parents' language.
Mm-hmm.
Or so then if if language is stripped away from people because they want them to be English only,
Right.
then there's a way to oppress them as well.
Right.
It's an
Yes.
oppressive way for them, for us to assimilate to a culture, that
Right.
so that's something
Yeah.
that, yeah, that I
Yeah,
have.
and that's all part of the othering, right? Is like being able to kind of strip away these aspects of individuals that make them unique in their culture and in their identity, and kind of forcing them to assimilate into American culture, whatever that is, right? Which is really, American culture is a very diverse culture made up of many languages, people from all over the world, different belief systems. I mean, that's what this country is founded on, right? Is we're a nation
Right.
of immigrants. Um,
Yeah.
Absolutely. And you mentioned, just going back to physician bias, you very poignantly said how, you know, your perceptions of how you see people, what you think about their beliefs, those, affect how you treat them, how you see them, but it also affects your clinical decisions. And this is why this is
Mm-hmm.
so dangerous, right? Is because it affects how you assess them, right? Because that's a
Mm-hmm.
huge part of what it being a clinician is. Like, okay, based on what this person tells me, these are the conclusions that I'm drawing about their health condition based on what they told me and based on what I see and think and believe. Because unfortunately, bias does enter into it, right? But you're absolutely right. You have to check your bias and say, wait, is this something that am I making this up? Is this something that perhaps I'm imposing on this person? Or is this like a real thing, right?
Right.
Um,
Right. Right. Right.
so,
And
and there's tons of studies that support this, right? That, that implicit bias, which is that unconscious bias, which I believe is not so unconscious, in actually working in healthcare and actually seeing how patients are treated on a daily basis, that some of this treatment is very intentional. But there's
right.
really no checks and balances for that. So it's not
Yeah.
as if there's a system in place to really mitigate that kind of behavior, right?
Yeah.
Um,
And
but
for example, in therapy, I'm sorry to
no, go
cut you
ahead.
off. In
Hmm.
in therapy is that 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 we over pathologize, right, the
Hmm.
behaviors of migrants,
Hmm.
or people who differ in the values and belief systems of the dominant culture, which
Hmm.
probably will be, that a very Eurocentric, white,
Hmm.
middle class, that
Hmm.
so for example, a kid who translates for their parents, not in the office, outside in their
Hmm.
daily living activities, that then can be seen as a parentified child, and that can pathologize the kid and also the parents' ability to parent. So it's that's part of their immigrant story. That is part of how they are navigating different systems as a migrant, family. It not necessarily needs, it's a deficit, on the parent or the child. And unfortunately, yes, that I met so many perhaps people who have bias in reference to the role of family members, in migrant families.
Yeah,
So yes.
absolutely. Yeah, absolutely. I think in healthcare, it's super important though. Like people feel safe having family there, and that's wonderful. But because the conversation that takes place is like a legal document, and because some of the information that you're giving is really, it's just imperative that people understand that what's happening to them, why it's happening to them. And in my experience in using family members to translate, well, one, in healthcare, we have the means to be able to get official
Right.
translators that
Hmm.
people can do this.
You might
But
not have the time, right?
yeah,
Yeah.
but sometimes family members also don't quite get it themselves, right? So then that
Hmm. Hmm.
translation, there's a lot that can get lost there. Um,
Yes, yes, yeah, yeah,
so it's
yeah,
just
for
super
sure.
important. It's super important. Okay,
Yes,
so
my friend.
yes, so much to talk about othering. So we talked about language, we talked about physician bias. So in terms of like racism, so adding a whole nother dimension. So we kind of talked a little bit about language and culture, right? Like being from outside of the country, speaking another language. But then when you add another dimension to that, which is that you're a browner person or a black person
Right,
who is
right,
coming
right,
from another country, particularly a Spanish-speaking country where, there are Afro Latinx populations that are represented in every Latin American country, right?
right.
You don't
Mm-hmm,
really hear as much about them. You don't see them,
mm-hmm.
particularly in the mainstream media. Um, but in your experience, what do you feel like that dimension kind of adds to their experience of being a new arrival to this country,
Yeah,
or not, or an
definitely. I
old
think.
arrival, because people experience this and
Yeah, yeah, yeah,
they've been here for
yeah.
generations. So
Yes, and I think people, there is, they they become invisible, right? They
yeah.
become invisible in especially in the in the experience of Latinx Black migrants first or second generation, that we were raised and our ethnicity is the same thing,
Hmm.
so then how there is a loss, a
Hmm.
loss of identity, right
Hmm.
right there. And soon as that they become invisible in this in this society that is very centered on binaries, too.
Hmm.
So I
Like
think
black
that
and white,
definitely, yes,
old and young,
so yes, so in
English,
this
non-English.
English, no English, right? Black or white, that's it, so but I think that like as you share, this intersectionality piece, that Black Latinx or darker skinned Latinx, they are discriminated against based on their immigrant, status, their immigrant, the level of how far or how long they've been here, how far they're getting, and then race, and the other and from the other side, and that burdens their experience to a greater extent. So then they become kind of like double invisible, that. So it's very important, I think, that for providers everywhere, to acknowledge the intersection of those identities, that they are not just Latinx, these are, that folks, individuals that are burdened, by the treatment of very, a racist society that burdens their experience coming from all of these ends, for
Mhm.
because of race, because of immigration, because of nationality, and because of gender. If
Mhm.
we are, in a hierarchy of power,
Mhm.
when it comes to migrant blacks and brown, there will be, at the bottom, right? That
Mhm.
uh, so I think it's important for providers for us to acknowledge the intersection of these identities, to be conscious of how our own, identities of power and privilege, it might become, an obstacle in the way that we see, think, and treat our clients. Yes, it is even a more burden experience for dark skin and Black Latinx migrants,
Mhm.
is for
Mhm.
sure. Yeah.
So I know much earlier you mentioned stigma as well, and how do you feel? I know it's really hard because there are so many barriers to people accessing mental health that are systemic, that are interpersonal, and that are internalized in themselves. But what do you feel like we can do to kind of open the gates, open the doors more to encourage people to seek mental health? All of these kind of intersectional identities, create their experience of living in this country, which can often be you know, very traumatic, in terms of the
Mm-hmm.
day to day, that can compound over time and just make people feel devalued. And so, what is it that you feel like we can do better as providers
Oh, you cut off.
to try to mitigate some of that stigma? Oh, I'm sorry. I said, what is it that we as
So that
providers can do to try to help
you
mitigate the stigma?
Yeah, I think that I think that not being, for all of us, when there is a stigma in having access to mental health services, there is so much power in naming. Naming first of all that people might be reluctant, might question, might have their own ideas about is this something that I want to do. So yes, naming it, I think it's is definitely important, and also using inclusive, inviting language,
Mm-hmm.
because then we often, as providers, as clinicians, as psychotherapists, we use language that is too clinical, and then that might not be something that people might feel open to it. So if we say, that is it mental health services, we say, it's a dialogue where you
Mm-hmm.
can share about how you are feeling, what's going on, have another person, to help out, then I think that yes, that's something that can be helpful. So naming, what is, mental health, naming, is the stigma, using inclusive language that is inviting, that is helpful, that is, people feel more open, more welcome, that to talk about their pains, that um, and also not be, complacent. I think that many of us say, there's a stigma, people, migrants, the migrant community, Latinx, they don't believe in therapy, and that's it. We don't do anything else about it, and that's it shouldn't be, this shouldn't be it. So then I think that, for example, in schools, to talk about more, what is it like um, to engage in conversations about how we're feeling, all of us, that in hospitals too, same. So then that's what I think, that this issue around stigma needs to be addressed at a local, state, and government level, that unfortunately, so for example, in the Latinx migrant community, we are less likely to receive mental health services, right? But we are more likely to be diagnosed. We have, for example, in Latina adolescents, it's a very high percentage of suicidality and
Mhm.
depression. And that hasn't changed in the last 10 years,
Mhm.
and there has been very little change. That so um, so yes, that being able to. So then, if yes, we're the least likely to receive mental health services, but we are the more likely to be diagnosed, to receive IEPs, to be called to ACS, so there is that disparity, there, and so I think that yes, let's name it. Let's talk about it. There's so much power on naming all of this, uh, our own experiences,
Yeah.
or the experiences in the community. So I think that let's start with that, and then hopefully we'll see where can we go.
Yeah, absolutely. And more funding for mental health. I mean, as we have seen,
Yeah.
particularly with when, for example, mental health providers ride along with the police, for example, because we know a lot of what the police do is not necessarily police work, right? A lot of what they're
Mm-hmm.
responding to are, calls of distress, issues with individuals who are having mental health crises, which they're not really fully equipped to handle, right? So, definitely more funding, especially in public venues for mental health advocates, mental health services, so that people can really access it at all levels of their lives, right?
Mm-hmm.
And we won't see this necessarily this criminalization of individuals simply because they have a mental health issue, right? Or throw them in jail because
Right.
there's really nowhere else to put them or no one who can help them. Um,
Right.
so yeah, I
Mm-hmm.
mean, I definitely agree that absolutely naming, but I think um, we as a society have to value this and put our money's where our mouth is in order to really ensure that everybody can get the help that they need to become healthier individuals and live healthier lives. Right? They always
Mm-hmm.
say that a society is judged based on how they treat their most vulnerable citizens. Our society is
Mm-hmm.
really terrible with that. I
Yes,
wonder
yes,
how
yes.
history will judge us.
How it will. Yeah, that's true. And I think when it comes to because that is who I see, who I am in reference to what makes Latinx migrants come to therapy. I think that also once they experience it, that
Hmm.
once they have a culturally sensitive provider,
Hmm.
once they have times where they can come and not
Hmm.
only so then that they are open to it, and then they
Hmm.
say to their family friends, they talk about therapy. I had men say, I never thought that this will work. As
Hmm.
soon as I came in, I knew it wasn't going to work, but I gave it a shot.
Hmm.
That, and they will come. They will come every week. So then I think that, and those are the parts that also gives me hope.
Hmm.
That give people choices, give people access, and you'll
Yeah,
see where they will,
absolutely. Yes.
if they use it. Yeah.
Yes,
Hmm.
absolutely. Access is totally key. All
Yes,
right,
yes, yes,
my
yes.
dear. Thank you so
All
much for
right,
this
my
amazing
friend.
conversation. We have so far to go in terms of trying to really
Yes,
destigmatize mental health, but also really kind of understanding all of these intersectional identities that affect our experience and our mental health, right?
yes,
So
yes,
it's
yes.
it's so thank you so much for joining me today.
Thank you. Thank you for inviting me to your
And
little
thank you,
space.
everybody, for coming.
Yes, yes,
If
yes.
anyone has any questions, you can feel free to put them in the chat for Miss Sylvia or for myself. We Let's see. We don't have any questions so far. It's just good. All right. People
Okay.
can always just post in the comments any questions you have for us, and we'll definitely answer them for you. Okay,
Okay,
everybody.
my friend, enjoy your Sunday
You
and
too.
let's practice Spanish.
Practicamos.
Practicamos.
Okay, bye
Okay.
bye.
Ciao, ciao.